Dr. Herberman, please proceed.
I want to thank this committee for inviting me to talk with you today about the important concerns that have been raised about cell phones in our health. As the chairman nicely summarized, I am a physician and cancer researcher and the founding director of the University of Pittsburgh Cancer Institute, UPCI. I'm here with you today to discuss my reasons for being concerned about the potential for health effects from cell phones that led me to develop a simple precautionary message to reduce exposure now while we develop new research to better measure the possible health impacts of cell phone and cordless phone use. A little bit about the UPCI. It's ranked by the National Cancer Institute, NCI, among the top 10 cancer research centers based on cancer research funding. For 2 decades before coming to Pittsburgh, I worked for the NCI with teams of innovative researchers. I have published more than 700 peer-reviewed articles. Although I am a physician scientist, I need to point out that I am not, as Dr. Carpenter is, an expert on cell phones and cancer risk. As history tells us, there are examples where delays in reducing exposure to cancer-causing substances have led to large increases in cancer. Tobacco use is one striking example. Mindful of lessons learned, the UPCI's Center for Environmental Oncology began a process more than a year ago of reviewing evidence on the possible association of brain cancer with the long-term use of cell phones. During this process, I became aware of a growing body of scientific evidence indicating that long-term frequent use of cell phones, which receive and emit radio frequency RF signals, may be associated with an increased risk of brain tumors, including malignant gliomas, the type of tumor that Senator Kennedy recently developed, as well as Dr. Marks. This particularly concerned me since in the United States today, more than 9 out of every 10 adults uses a cell phone, a remarkable number that has doubled in just the past 5 years. Worldwide, there are 3 billion regular cell phone users, including a growing number of children. Generally speaking, it is important to stress that children are not just little adults. They often are much more vulnerable to the effects of environmental exposures. For cell phones, this matters because the skull of children is much less dense than the skull of adults, and modeling research has shown that cell phone RF signals are absorbed much deeper into the brains of children. In contrast to the United States, as Dr. Carpenter has pointed out, in the Scandinavian countries, widespread cell phone use has been prevalent for more than 2 decades. Dr. Leonard Hardell, a distinguished oncologist, finds that people who have used cell phones the most have double the chance of developing malignant brain tumors and also tumors on the hearing nerve called acoustic neuromas. Dr. Hardell has also, as Dr. Carpenter just summarized, recently reported that teenagers who use cell phones have 5 times more brain tumors by the age of 29. I recognize that many studies do not show any association, but most of these negative studies have followed people for a relatively short period of time. It seems likely that brain cancer can take 10 or more years to develop. In addition, few studies have controlled for cordless phone use, and these cordless phones also release RF signals. In population-based research, clearly methods always matter. My concerns about the risk for developing brain tumors from long-term cell phone use, and my particular concern about risks for children, coupled with the knowledge that experts in several other countries had issued precautionary advisories, led me to issue an advisory in July to our physicians, scientists, and staff. The advice was straightforward and has been widely shared by colleagues and news outlets around the world. Within a week of the distribution of the precautionary memo to our staff, the Israeli Health Ministry endorsed our recommendations. Our warning has also been translated into German, Portuguese, and Spanish. Our advisory recommends that you use cell phones, but carefully. Don't keep them turned on and on your body all the time. Use an earpiece, a headset, or a speakerphone mode. Based on the current body of evidence, as a physician scientist who has devoted my life to preventing cancer and saving lives, I cannot tell this committee that cell phones are definitely dangerous, but I certainly cannot tell you that they are safe. How are we going to resolve this important matter? Should we simply wait and watch, or should we take simple precautions while we undertake additional, more definitive research that will tell the whole story? I urge this committee to work collaboratively with the cell phone industry so that independent researchers at our institution, MD Anderson Cancer Institute, and the National Cancer Institute and the National Institute of Environmental Health Sciences will be better able to produce the best, most accurate study of cell phone use and health effects. The future of our children and grandchildren, I believe, demands that we work together to understand the potential risks from cell phones and, if necessary, to develop effective solutions to reduce future health threats. And in closing, I would just say that I find the old adage to be better safe than sorry to be very apt for this situation. Thank you.
I thank you very much, Dr. Herberman. I want to note that Congressman Burton from Indiana is with us, and in a previous Congress, he was chairman of the full committee. So I appreciate Mr. Burton's presence here.